Tri-Cities community will have to wait longer than expected for a mental health and drug addiction treatment center. Apple Valley News Now's Alyssa Warner reports plans for the newly renamed Columbia Valley Center for Recovery have been delayed.
So right now we're looking at the end of 2025 to open the doors.
Benton County Deputy Administrator Matt Rasmussen says development plans are making progress, even if it's slower than they had originally hoped.
We are going through what they call a validation phase. So that's where they come in, they take a look at all of the existing conditions, they take a look at what we ultimately want to do with the facility, and they put together a plan, a rough plan, and a cost estimate.
He says the next big step forward should happen around March, and that's when we could start to see some of the construction work actually getting underway.
Once they have a good idea of where they're going to work, they'll want to go in and demolish all of that so that they can look at what they have to work with when they're done. They can do the demolition while we're still working on the design, adjust the design based on what they find, and keep moving those two simultaneously forward.
One of the big updates that this project has gone through since development work started was the county buying this warehouse with plans to turn it into part of the recovery center. Rasmussen says once they're done with the building, you likely won't even recognize it.
The Kennewick Hospital came with a restriction on doing crisis stabilization services there, and so the county decided, like, hey, we need a place that doesn't have that restriction. So that's where we went and ultimately got the warehouse building. It would be significantly redone though. A lot of the masonry blocks, those would be removed. There'd be a lot of windows and doors, and it would not look anything like it currently looks.
At this stage in development, plans are still fairly fluid when it comes to specifics about what services will be offered, where, and when. But Benton Franklin Recovery Coalition Chair Michelle Gerber says this problem is not going away.
We now have about 30 million people in the United States in active addiction. That's almost 1 in 10 Americans. It's really important to get the resources close to home for several reasons. One is that you can get people in a timely manner. They don't have to be on a waiting list for someplace in Seattle or Spokane. So if we have that here, people can go in as soon as they need to go in before the problem gets worse. And another thing is that families can participate. Families can have family classes and education at a local treatment center, whereas they can't if it's far out of town.
The county is working with the Recovery Coalition to make sure that help is accessible in ways that wouldn't be possible without that partnership.
There are going to be things that public money is not allowed to pay for, and we'd like to raise money for those things. Child
care is a great example where, the county can't necessarily pay for people's child care, but the Recovery Coalition through their partners could, or transportation or hotel costs, and some of these things that really make the recovery center from a nice facility to a great place for people to come and get the services they need.
We'd like to have a gymnasium inside the center. We'd also like to have computer rooms where people can learn skills. We want training centers. We also want a family center inside the recovery center where families can visit their loved one, receive education, and even bring their children. So we want some play areas and some family lounges, family conference rooms, and private money is going to have to be raised to pay for those.
Benton and Franklin counties have instituted an extra sales tax to fund the recovery center's day-to-day operations. For Apple Valley News Now, I'm Alyssa Warner.